Welcome to the Wound Care Clinic of South Jersey. If you have a wound on the bottom of your foot or on the ankle, most of the time you will require a foot or ankle brace. This will reduce pressure and increase the healing process. The first ankle brace that we have here today is a cam walker, or sometimes more comprehensively known as a diabetic foot walker. This will relieve pressure on the bottom of the foot. It's easy to put on, and at bedtime you can take the brace off and you can sleep comfortably. The brace has a nice insert inside it to reduce pressure on the bottom and assist you in the healing process and also promote function during that time. The second brace we have here is a brace that is used sometimes required after foot surgery, sometimes mild paralysis, and or sometimes people that may have surgery done may require certain types of custom-made orthotics where this brace may be required to allow them to walk more freely. This is just one example of a shoe, but this brace will fit in most shoes. The brace fits in the shoe and the person can slip their foot in there and then they can walk. This brace actually will lift the foot up. Some people have ankle problems that also affects their feet. So therefore, the person will need this to protect the bones in their foot and ankle. If they don't wear this, they're subject to potentially a stress fracture and also reduce the risk of another recurrence of a foot wound. The next brace is way more advanced. Usually when patients are confronted with a lot of problems with their feet involving wounds and dislocations of the ankle, this brace is required because they can't do without it, or they may need a cast for the rest of their life. So I think this is a better option because this particular brace is custom made to the foot and ankle and to the lower leg. The fiberglass cast is applied to the foot and the ankle and the lower leg. It's sent off to a lab. It comes back. It's also called a Crow boot. The Crow boot is short for Charcot Restraint Orthotic Walker. The Charcot foot disease is specific to either a congenital anomaly, which means you got it from birth, or the diabetic foot, which affects the circulation. Now we got to remember that circulation runs through the bones. And now when those bones have a decrease in blood flow, that affects their integrity. So we cannot afford to not control our sugar, and we must maintain our diabetes. So therefore, if by chance we have more uncontrolled diabetes and more advanced stages of diabetes, and someone does have a problem like Charcot foot disease, the Crow boot is an option that will save the leg and keep the person functional and walking. Last but not least, this is not my favorite shoe. However, when we have a person that's at great risk of falling, this is a pressure reducing shoe that has a special insert that can be modified by taking little inserts out of the bottom that can accommodate an open wound on the bottom of the foot. Now we can reduce pressure not only by the shoe, but using the shoe with potentially a walker, a cane, and maybe even a wheelchair. But remember this, if we don't reduce the pressure on the bottom of the foot when there's a wound, it will not heal. So that's the main goal. We can put all kinds of wound dressings on your feet, we can provide all kinds of therapies, but if we don't confront the first line of defense, which is reducing the pressure, which allows the blood flow freely, we will not achieve our goal. So allow us to do our job and help you the best way it can, and then we can make some choices and fit your needs.